In general, my answer to that is no. The worst case scenario, if you have a dog who's having seizures so bad that you can't control them, you actually put them under anesthesia to stop the seizures. So the short answer is no, it's not bad. The longer answer, some drugs are better than others when you're putting an epileptic dog under anesthesia. But by definition, a dog with primary or idiopathic epilepsy should have a normal brain. It just doesn't work 100% normally all the time, hence the seizures. And so those guys are safe to anesthetize. You avoid certain drugs, choose some over others, and they generally do great.
I guess for the veterinarians, because that's a phone call that I receive all the time of, hey, I'm seeing your patient that, you're treating for seizures and we're about to do a dental or a neuter or a mask removal or whatever. And they kind of ask me for an anesthetic protocol. I'm not asking you so much for an anesthetic protocol, but are there certain drugs that you prefer to avoid? And I know there's certainly one that we were taught in vet school to avoid. And
yeah, I guess the answer to that would depend on whether we know the dog's brain is normal or not. So if the dog has had an MRI and we know the dog has a normal brain and it's definitively an epileptic, my answer is use whatever drug protocol you're comfortable with. Maybe some diazepam, propofol, isoflurane. Honestly, we have some literature now. What we were taught in vet school is that you wanted to avoid ketamine in dogs with brain disease. There's some stuff that's come out in the last couple of years that's fascinating, that ketamine actually can be really useful in dogs with status epilepticus. And so we can use ketamine for seizure control. We used to think it was bad for the brain because of what it can do to pressure in the brain. So I would be okay using it in a dog with epilepsy who has a normal brain, but I'd potentially be a little bit nervous using it in a dog that maybe had a big brain tumor, or that we didn't know for sure what was going on. So acepromazine, we were also taught that ACE could cause seizures, and that has actually been disproven. There are two different studies that show that they took dogs that had epilepsy, that were known seizure dogs, and one study in particular, the dogs were having x-rays for like orthopedic reasons, bad knee, a bad elbow or something, and they were given acepromazine as part of the sedation for the x-rays, and it didn't make a difference. So I have zero problem. I actually will sedate some of my epileptic dogs in the hospital with acepromazine because it works so nicely in the crazy young
husky,
Labrador husky with epilepsy that is singing the song of his people in the ICU. Yeah, so we use ACE all the time.